Welcome to Biology for Bastards, teaching biology in the most profane way you've ever seen or heard. I'm your host, John Doty. Thanks for listening. We have a very special fucking episode for you today. This one is covering something that's everybody's mind right now, and it's a little bit different from what we've normally done. This one is all about the coronavirus, or the COVID-19. This one's been researched extensively by my research assistant, who is a student of public health and everything. Shout out to Keely for doing all that for me. Kind of awesome that I got a research assistant. But there's a lot of misinformation out there about what the fuck this is, what the fuck we should be doing, all this stuff. I've seen videos of young people being shit faces, and fuck sticks and everything else. So we're just going to go through it, and hopefully if you're a little unsure about what's going on, this clarifies some stuff for you, and, you know, maybe the swearing lightens it up. And since everybody's fucking stuck at home, it gives you a little something to do for a little bit. So there we go. Everybody wins. So, starting off, what the fuck is a coronavirus? Well, according to the World Health Organization, or the WHO, it's a large family of viruses that cause illness ranging from the common cold to more severe diseases. So SARS, that's a coronavirus. MERS, MERS, whatever the fuck it is. Middle East Respiratory Syndrome. All these respiratory syndromes and everything, those are all caused by coronaviruses. Okay, so coronavirus is not unique to COVID-19. COVID-19 is just a specific type of a coronavirus. And all coronaviruses are zoonotic, which is a fancy science word for you get them from fucking animals. Okay, not actually from, well, I guess you would get, if you fucked an animal, you would probably get a zoonotic disease. But usually you get them from eating infected animals or being in like open markets around infected animals, or just being around infected animals in principle. So eating infected animals, being around them or fucking them, you get zoonotic diseases like coronaviruses from infected animals. Now, the one that everybody's concerned with now is a specific strain of coronavirus known as COVID-19. And it's named COVID-19 after the year it was first identified, which was 2019. And while it's true the first case was reported in Wuhan, China, back in 2019, do not fucking call it the Chinese flu or the Chinese virus like fucking Donald Trump is doing. Like, I don't get political on it, but don't be a fucking racist and call this the Chinese whatever. Okay? The Spanish flu that killed a bunch of shit ton of people in 1918 started in Kansas. Okay, it was called the Spanish flu because they were neutral at the time. They were kind of at the leading edge of reporting about it. That's why it's called the Spanish flu. But this stuff is not the fucking Chinese flu or anything like that. Don't be a fucking racist. Don't be xenophobic. Don't be a prick. Don't be a dick. Don't be a bit. Whatever you... It's COVID-19. Or just leave it as coronavirus. Everybody knows what the fuck you're talking about. If you say coronavirus right now, they're not going to be like, oh, which one are you talking about? Are you talking about SARS? Are you talking about MERS? Are you talking about... No. COVID-19. The whole world's fucking shutting down because of it. Now, that being said, it spreads mostly through contact with respiratory droplets. So that means if somebody coughs or sneezes, or just like sprays when they're talking, that is how this thing spreads. So according to Reuters, it can remain viable and infectious in droplets in the air for hours. So hours just floating around in the air, or days up on hard, non-porous surfaces, which is kind of fucking crazy to think about. Like, and just survive for days, just hanging out, waiting for you to come and get sick. So this is why the washing your hands and don't touch your face is such a big thing, and I'll get on more of that later. Because you don't know who touched whatever you're touching last. You don't know their status, whether they have it or not. But we'll get on that more later. Now, symptoms of it. frequently include fever, tiredness, fatigue, a dry cough. Those are the main ones that always pop up. But you also sometimes get aches and pains, nasal congestion, runny nose, sore throat, possibly diarrhea. So it sounds like a basic fucking cold. Like you just have a cold. The problem is what it does. Okay, it's not just a cold. We'll get into that later. But the symptoms seem very, very similar to a common cold. So, yeah. This is just fucking nuts. This is crazy. Now, you might be wondering, how the fuck do I not get this? Because it's not a good thing to have. You don't want it. And we'll get there later, but everybody can get it. Even you young people. Well, you know what? I'll save that rant for later. I got it. I know I keep saying I'm going to come back to it, but I actually have a script written out this time. So I'm going to go through it. So how do you protect yourself? 1, wash your fucking hands with soap. Like soap. Don't just like run water on it. Use soap for 20 to 30 seconds. So 20 seconds starts now. We're counting and we're washing our hands and we're still washing our hands. It's been 7 seconds. We're washing our hands, still washing. You're about halfway there. Keep washing. You're washing and you are now done. That was 20 seconds. That's how long you should be washing your hands for with soap and water, because what you're doing is you are knocking the virus off of your hands. You're breaking down some of it and then you're rinsing it away. So you need to be washing your hands. Any time you come into contact with something that may have been infected, you need to be washing your fucking hands. It's a lot better than hand sanitizer. But if your choice is nothing or hand sanitizer, make sure the hand sanitizer you're using is at least 60% alcohol. Anything less is worthless. 60% is the magic number. But so I'm saying all this like wash your fucking hands, use hand sanitizer, all that shit. Don't do it too much. And more on that later. On how to avoid washing your hands too much. But if you do it too much, your hands dry out, then they crack open, and that gives the virus a place to get in your body. So if you are washing your hands constantly, make sure you're using like lotion. Keep your hands hydrated. Everybody likes soft hands. But just make sure you are washing them after you come in contact with something that might be infected. Okay, and another way to protect yourself is try not to touch your face, your mouth, your nose, stuff like stop picking your nose, stop touching your face, and that's hard. We touch our face a shit ton. But that's a really good way to keep from getting sick. Don't touch your face. Wash your hands, don't touch your face. Those are the two best ways. Wash your hands, don't touch your face, and you should be fine. As long as you do this other stuff that I'm going to get to in just a sec. Okay, so that's protecting yourself. How the fuck do you protect others? Because this is a very infectious disease. It does spread. If you sneeze, if you cough, cover your fucking mouth. Like cough or sneeze into the bend of your elbow. Okay? Not into your hands, into your elbow or your upper arm. If you are encountering things that are frequently touched, clean and disinfect them. Okay? So like your countertops, door handles, light switches, remote controls, because as you're fucking locked in your house and you're watching a shit ton of Netflix, you keep touching that remote because it keeps asking if you're fucking watching. Yes, you are, but make sure you're wiping that down. Wipe down your phones, disinfect your phones. Your phones are filthy as shit. So make sure you're wiping that. And if you're talking on the phone, you're just breathing on it, putting all those respiratory droplets back onto your phone. So just make sure you're washing those. If you are sick, wear a face mask, because it's a lot easier for one sick person to wear a face mask than for 100 healthy people to do so. And if 100 healthy people are wearing face masks because they're afraid to get sick, when somebody needs a face mask, maybe they're a healthcare professional or maybe they're sick, there are going to be fewer face masks around for the people who need them. And this is where social distancing comes in. This is the one that's been pissing me off a lot. So, what it is, according to Johns Hopkins Medicine, really good source. I'm going slow so everybody hears what I'm saying and does not miss it. You are social distancing is deliberately increasing the physical space between people to avoid spreading illness. I am seeing a lot of especially young people ignoring this. But this is why everything is canceled. Why colleges are closed, libraries are closed, businesses are restricted. You can't eat in businesses anymore. Parades, concerts, why all this shit is being canceled is because social distancing works. What you try to do is flatten the curve, which means you keep the spread of the disease to a shorter bell curve. I think we all know what bell curves are, rather than an exponential growth. So what it does is it allows hospitals and medical professionals to keep up with the number of infected so that they're not overwhelmed. But you need to be social distancing. If you have symptoms, even if it's just like a fucking cold, it's better to be safe than sorry. Or if you've been in contact with a known positive case, self-quarantine for 14 days. Okay? And that 14 days is important. It's not just an arbitrary, like, oh, it's 2 weeks. It's a fortnight. It's a fucking fortnight. Let's take a fortnight off. No. Okay? COVID-19 has an incubation period of up to 14 days, which means you can have the illness for up to 2 weeks without showing symptoms. And in that 2 weeks, you are infecting everybody you're coming in contact with. That's why the 2 weeks is an important number. So if you feel like shit, if you think you have it, if you've come in contact with somebody who thinks they has it, if you come in contact with somebody who definitely has it, self-quarantine. Work from home, limit your visitors, have other people go out and get your shit for you. If you need to go to the grocery store, but you've been exposed to it, find somebody to go do it for you so that you're not spraying the shit all through the grocery store. And then 6 feet is the magic number. That's what reduces the spread of the respiratory droplets the best. That's the magic number of social distancing, 6 feet. Now, I saw this in public. I'm not going to say where, but there were some people trying to social distance each other, and one person stuck their arm out, and they were like, oh, that's as far as... No, that's 3 fucking feet, give or take. Both people need to do that, and that's how far apart you need to be. 6 feet. Now, here's why we need to avoid it. This goes out to everybody, but especially, and I'm going to use the quote that my research assistant put in my notes. This is why you avoid it, all you dumb bitches who keep partying. Because I just think that's great. So, as of now, and this is March 19th at 11 a.m. Central Time. Shit is changing constantly with this information. Okay, but as of right now, 80% of people who have it have mild to no symptoms and need no treatment, which is great. That's 4 out of 5. Okay? For that other 20%, it is severe, especially in older folks, people with autoimmune or chronic conditions like diabetes, asthma, heart problems, all this shit. That 20% require hospitalization for help. And we're finding out, it just came out this morning, that you young people, and I know the demographics of most of you who listen are young people. You young people we're starting to find out that you get severe cases of this. You're not dying from it, but you're being hospitalized from it. And if you don't require hospitalization, but you're one of those 80% who have like very few or no symptoms, you are spreading the shit out of this to people who could fucking die. And it's not just old people. It's not just babies. It's people that you may not even know that they are one of those vulnerable groups. Somebody with diabetes. Somebody who has had cancer. Somebody who has cancer. They're already fucking going through enough. Stop being a selfish dick. Stay home. Watch the fuck out of Netflix or something. And just let this kind of take care of itself. There's nothing we can fucking do. Okay, we are doing what we can with this social distancing. It's brand new. This is a novel disease. If you've seen it listed as the novel coronavirus, that just means it's fucking new. We don't have immunity to it. That's why it's wiping out and spreading like crazy. We don't have a vaccine for it, and it's going to be a long fucking time until we do. I'm getting worked up. Okay, we need to take this shit seriously. We do. Right now, the numbers that we know, it's like 200,000 in the world or something. That is very low to what it actually is, because we don't have the test. The tests we have compared to how many people we need to test, there's a huge discrepancy in those numbers. So there's a lot more people out there who have this than we know of. And because the symptoms are that of just a common cold, you may have had it or you may have it and not realize you have COVID-19. And you can go and you just spread it to people and get them sick and possibly kill them and just being a little fuckstick. I see these videos and these pictures of young people, 20-somethings, seem to be the big fucking group who think they're so fucking invincible. You guys have loved ones that could suffer from this. Don't be a dick. Ugh. I'm getting worked up. I think we're just going to end there. That's most of the information. All the sources are going to be in the show notes, but it's stuff from like University of Michigan, the CDC, the WHO, Reuters, Johns Hopkins. People who know what they're talking about. So, hopefully, everybody listening, hopefully you're healthy, you're doing stuff that you should, you're social distancing. If you're super bored while you're social distancing, reach out. I'm on all the social media. TikTok, Facebook, Twitter, Pinterest, Byte, Facebook, Twitter. Those are the big ones. I'm on all of those. At Bio for Bastards on every single one. Reach out if you're bored, because I'm fucking home, bored out of my mind too. It'd be nice to talk to you. So say hi. We can chat about stuff. If you think I'm wrong about anything I just said, fuck you, I'm not. I'll stand by that. But if you want to talk, just reach out. I'm around. So let's see. That's all the social media stuff. Don't forget to rate, review, all that stuff, especially on Apple Podcasts. I don't know why, but Apple Podcasts is like the holy fucking grail of podcasting. So if you haven't rated me on there or written a review, with all your free time, why not? Give it a shot. I'd appreciate it. You could spread the word. I know there's a lot of you who are stuck teaching yourself biology now that classes are all online. So spread the word to people you know in a similar place as you. I'm more than happy to answer questions if you hit me up on, especially Twitter. That seems to be the best place. But yeah, we'll wrap it up with that. I'll wish everybody the best of luck. Everybody stay healthy. Our intro and outro music is the song Feeling Good by Purple Planet Music. And expect season 2 to come a lot sooner than May, because I'm bored, to be perfectly honest. Expect it in the next couple of weeks. I'll stand by that. And until next time, thanks for listening.